Hi, everybody. Deirdre Virvo here. Thank you so much for joining us today on Let's Talk Seniors, memory care issues, Alzheimer's, dementia, and Parkinson's. Very relevant topic these days. We are going to be talking about Medicaid versus Medicare today. So a lot of you already know me. I'm Deirdre Virvo, and I am an author and just opened up this week a assisted living home in Shelton, Connecticut, for 6 seniors with memory care issues, and memory care or just assisted living. So kind of something that we don't have here. It's a home that's just for 6 seniors with either memory care issues or need assisted living. They'll be living together just like a beautiful family unit with round-the-clock care and entertainment brought in and all the special services that they need. So we're really excited about that. If you want to hear more about it, please don't hesitate to call me at 203-570-4839. Oh, here's my number. Or this number here, 203-689-7562. Also, I am a senior care specialist who wrote a book called Home to Home, the Step-by-Step Senior Housing Guide. And I'm very happy to mail these. I've been mailing them out right and left. I'm very happy to mail you a free copy. You don't actually have to go on Amazon and buy one. I would be happy to mail you a free copy. Just either email me at dvirvo@gmail.com or give me a call at 203-689-7562. Without further ado, we are going to welcome a special guest, Elena Goggin. I want to say that right. Elena Goggin from Elder Life Care Planning. She is going to be talking today about Medicaid versus Medicare, which is pretty confusing just in and of itself, each one of them. But she's also going to be doing a comparison. Who gets what? What do you need it? When do you need it? Who can apply? Please feel free to make your comments and ask questions. Most people just comment, great show. Feel free to ask questions because that is what Elena is here for. Without further ado, Miss Elena, how are you?
Great, thank you. How are you?
I am doing great. So why don't you give us a little bit of background about what you do with the Elder Life Care Planning and how you know so much about Medicaid and Medicare before we get into that.
Excellent. So we do a multitude of things at Elder Life Care Planning. We care coordinate, care manage, and advocate for seniors. We help proactive seniors and seniors in crisis navigate their current situation and get them from where they are now to where they would like to be. And we have a conversation about their future, which many people, don't even think about until they have a bump in the road. And then we also help people navigate care placement and Title 19 and or Medicaid, however you call it.
Nice. So people come to you, like you say, when they have a bump in the road, meaning they have a fall, they can't go back home, something happens, or I guess the kids go there and notice that they're not bathing or not walking or falling a lot and see bruises and things like that. And then they come to you and say, Elena, help, like, what can we do? And what is the first steps? What are your first steps?
Well, I think the first step is to figure out, gather information, right? So really what is going on? Is this a care situation or a healthcare event that has been kind of trickling in that they've been dealing with for a while? Or is it something sudden and new? Then looking at their finances and then having a home assessment, which we've talked about in one of our prior conversations. I think that is so important, knowing, it's interesting how children, including myself, I take care of my mom, how we view our parents, and then how maybe a professional might view them. So looking at making sure that we're not overlooking anything, and then start where you're at. I like to make sure that any crisis is handled immediately, and then we can look at the future and do the planning that's needed. My job is to provide information and education and options. Their job is to choose.
Super. But you can also help get people onto Medicaid if that's what's needed.
Yes. So so a client just came in yesterday. Mom is at home. Things are happening quickly, and we're not sure if home is the right place any longer, right? So And we know that she doesn't have an abundance of assets and resources to be able to keep her there indefinitely. So the question is can we keep her at home with a 24/7 caregiver paid for by the entitlement program called Title 19 or Medicaid? Or how do I want to say this? Or do we have to shift gears because maybe she actually needs to be in skilled care at this point? And also that would be a Medicaid application as well.
Is that also Title 19 if you need skilled care?
It is. Yeah. So Title 19 and Medicaid, they're used synonymously. So Title 19 is just the code, right? And Medicaid is the program. And in the state of Connecticut, we have the Connecticut Home Care Program for Elders. And that program oversees people at home. And they start out with some care that's needed, and then they go into up to 24/7 hours that's needed.
What is the program I hear about, now that you're speaking of that I hear on the radio advertised a lot, where are you already, do you want to get paid to stay at home and help your mom or dad? What is that where they're paying the
That is a wonderful program for family members that they would be paid by the Department of Social Services to take care of their loved ones. It's not available for spouses, right? But it is available for daughters and sons who are giving up their primary job to take care of their loved one.
And do you have to prove that you're giving up a job to do that?
Oh yeah, you can't have a full-time job and that same benefit. Yes.
Okay. And that is through the Department of Social Services?
Yes, it is. Yes.
That's pretty cool.
It is pretty cool.
So what is that called? Family care benefit? What is that called?
You know what? It's so funny. Somebody just asked me that just like a couple of days ago, and for this whatever reason, I apologize. The name isn't coming to mind. Some of my old lingo is just always there, and the new stuff that's out, all these new things like community choices versus the alternate care program. I apologize. I don't have that actual name, but there is an actual program.
We can look it up if we go to the Department of Social Services for Connecticut. That will be there. So anybody that's interested, including me, you can go to the Department of Social Services and see it listed there.
Well, and you know what I'll do is I will comment back into this memo with the program and the link to get to it.
Oh, super. Okay.
Yeah. So now I offer that if anybody is in that situation right now and concerned or questioning whether they could help their loved one, in this way, they should reach out to me and I'd be happy to guide them through it.
Super. I think that's a lot of what's going on right now. Like, I think a lot of people, if they're keeping their loved one home for safety from COVID and they're not working or may not be going back to a job, wondering what to do with mom or dad, this could be somewhat of a solution.
It can be, absolutely. I think a lot of people actually, even before COVID, a lot of children have been taking care of their parents without any help whatsoever. You're just doing it because it's needed, right? You're just not going to leave your mother without the care that she deserves, right? And we all don't want to put our moms or dads in a nursing home. I've always felt like moms and dads should be home. On a few occasions do I feel that maybe home isn't the right place, but most 80 to 90% of the time, I think home is the best place, and no one's really going to take care of you like your loved ones do.
Yeah. If somebody's taking care of you at home.
Yes.
You don't want to be home alone.
No, absolutely not.
Yeah. And it's funny because my mom is 83 and she's 100% with it still and driving and taking art classes. But since my father passed, I would love her to go to like a senior living place that she can be socializing, even though she loves her home. But it's a lonely place when you have a big house and nobody's in it anymore.
Yeah. And I think, again, like I said, home is great in most situations, right? But sometimes when the spouse is left home alone and socialization, especially during these times of COVID, that isolation was a concern to me before COVID happened, and even more so since then. And I just feel like, if our loved ones can afford some sort of community, I just think that, there's a better way to thrive in that environment than there is at home. More challenging to be socially active when you're home alone.
Yes, it's very hard right now. And you can't even get together with your loved ones or touch your parents.
Agreed.
Terrible.
Mm-hmm. Mm-hmm.
So, Elena, Medicaid versus Medicare.
Mm-hmm.
So now that we know Medicaid is Title 19,
Mm-hmm.
so when they talk about Title 19 spend down, I thought it was to get to Medicaid, but it is Medicaid.
It is. Title 19 and Medicaid are one in the same. You might also hear T19. You might see T with the Roman numeral system that says 19 and Medicaid. But Medicaid should never be confused with Medicare.
Okay.
They're very different.
I'm taking copious notes.
Yes. So Medicare and Medicaid are both government programs, right? Which is a wonderful thing. But Medicare is a benefit that you get when you're eligible for it when you're 65 and older, and it's an insurance benefit. So like we have insurance now, you go to the doctor and, the doctor's office sends you a little, bill, and what we call those EOBs come in the mail, and it says, okay, $80 out of the $100 is covered. You owe $20, right? Mm-hmm. Same thing with Medicare. For most situations, so hospital coverage is covered 100% of the time in most situations. And this is traditional Medicare. Doctors are covered 80% of the time. And people get a supplement to their Medicare, which will cover the extra 20%. Now there's Medicare Part A that covers the hospitals, Part B that covers the docs and other services like x-rays and other things, therapies. So there is Part D that covers prescription, and there's a Part C that is an advantage plan that is a scaled down version of Medicare. It offers all the same benefits. It includes Part A and B and D in it, but it has limited resources. Traditional Medicare with the supplement, you can pick a supplement to cover Medicare. They just have more resources.
But these all go with Medicare.
Medicare. Right? They should not be confused with Medicaid. So, Medicaid is not an insurance.
So is every American taxpayer entitled to this when they're 65?
No, that's a great question.
No?
Yeah. No, I'll tell you why. There are some occupations, fewer today than there were yesterday, but there are some occupations that never paid into Social Security, right? As I tried to get that out of my mouth, Social Security.
I got it, Social Security. Don't worry.
So those occupations could be, our police and fire, and teachers for a good period of time they had a defined pension program, and they get a pension as opposed to Social Security. Now, some people, like for teachers, they have the summers off. Maybe they would go out and they would get a part-time job during the summers to kind of supplement their income, if you will, and they would pay into Social Security. So if they had so many quarters, then they would be entitled to Medicare at 65.
So my mom was a teacher in New York, and she gets Social Security, Medicare, and a pension.
That's great. Good for her. So she must have been able to put in some quarters paid. You have to pay into Social Security in order to get Medicare benefits.
She never had a part-time job or anything. She just taught.
Yeah.
So could she have paid that as a teacher? Is that an option? Could she have paid that as a teacher? Is that an option?
It could be, absolutely. I'm not familiar with New York, and there are a lot of different programs. So in Connecticut, there's the Connecticut Teachers union that covers that. And we shouldn't be getting into all the nuances of this. But your question was, is everybody entitled to it? If you work a job that pays into Social Security, then yes. And then you'll get a Social Security check upon retirement. And there are these seminars that you can go to when you're ready to retire that give you the option to maybe retire at 65 and collect, or maybe you want to push it off to 67. Some people even push it off even farther, but that's a whole other conversation.
Medicare, does it go hand in hand with Social Security? Like you can only start doing that once you start collecting your Social Security income? Or can you opt to take Medicare at 65 and not your Social Security income till you're like 70?
So I'm not a Medicare benefits specialist, and that's a great question, Deirdre. And I love being on your show because you always ask really good questions. And I'm not embarrassed to say I don't have all the answers. That's not my level of expertise. I know just enough to be able to support my clients. And when we get into those detailed conversations, my job is to then refer to our vetted professionals that can help somebody make those decisions because they're personal. They're different for every family. They're different for every individual. I think the important thing to understand is Medicare is an insurance that covers doctors, hospitals, therapies, those sorts of things, and prescription.
So that's covered. And if you're entitled, that's free. You're not paying monthly, right?
So if you are, when you say if you're entitled, meaning if you have applied for Title 19 and you now have that benefit?
No, not the Title 19, that's Medicaid.
Oh, okay. Mm-hmm.
So if you paid in Social Security and now you're 65, 70 and you retired and you're getting Social Security income and now you're on Medicare.
Yeah.
Free, or you still have to pay monthly for that?
You still have to pay. It comes out of your Social Security as your Part B premium, Medicare Part. So you're paying for Medicare. You're paying for that benefit. And you're also paying for Part D, which is the prescription drug coverage.
But once you retire and you're getting, let's say you're collecting $2,000 a month on Social Security income, are they taking money out of your Social Security income check to pay for your Medicare?
Yep.
What?
Yeah.
Come on.
Small little amount, premium. Mm-hmm. Mm-hmm.
Okay. So we're going to continue, even though we paid, to pay for Medicare when we can get on. Okay. Now, why do we need Part A, B, C, D? Is that like if you take a lot of prescriptions, you want to supplement, or you don't need to? Let's say you have the money, you don't need to. Does this cost extra?
Part A and B are traditional Medicare. Part C is Medicare Advantage. It's not all of them. You're either doing traditional Medicare, which will cover your Part A and your Part B benefits, or you're doing a Medicare Advantage program, which is everything. It's your A, B, and your D, which is your prescription.
Got it. And that costs more, I guess.
Actually, that costs less. The Advantage plan was designed to help seniors on a limited budget, or like you were talking about, healthy seniors that don't need all the fancy plans because they don't go to doctors, they don't take any medication, but they don't want to deny themselves of participating in Medicare, right? So what's happened in the past, and again, this is not my zone of brilliance, and I know just enough, and I'd love to be able to share and definitely, answer all of your questions. But what's happened in the past is when we had healthy seniors that decided on retirement, I don't need that Part D benefit anymore, like that Part D, their prescription drug benefit, I'm not going to take it. Then all of a sudden, they get to a point where they need it. Then they become penalized, which is awful, right? So the Medicare Advantage program allows people that are healthy or those seniors that have limited resources, financial resources, that's another program where they could just buy in to Medicare for sure and getting their Part A, B, and D covered. Okay?
Okay. So, and basically, most people that went into the Social Security, paid into Social Security while they're working are eligible at age 65.
I believe that is the case currently. Yep.
So then, okay, so, well, then I won't ask you this. I'm going to ask you this question anyway, because it's on. So if you have a job and they're still paying your health insurance and you're 70, I guess you just wouldn't tap into this.
Yeah, again, it's deeper into the conversation, and I don't know the exact answer to that. There's a way to
work it around.
Defer it exactly without saying no to it, right? You're just not going to accept it now.
Okay. So
Okay.
Medicaid. So Medicare is for people, it's going to come out of their Social Security benefit a little bit. And Medicaid is what?
That's an entitlement program. It's not insurance. Medicaid is set up to help individuals, and I'm going to speak to the group of individuals that I'm talking to, that I talk to on a regular basis, and those are the ones that are over the age of 65. So that's our elder population, as we call it, right? I don't consider everybody an elder at 65, but I think of an elder fondly as somebody that, has wisdom and has aged, has been around here for a little bit. The Medicaid program for seniors and elders is available when people become medically needy, in the sense that they have a need that needs to be covered, some sort of care need, and they are running out of money to be able to take care of that expense on their own. So when people come to me, the first thing I'm asking is, what is the income and what are your financial resources? And then we evaluate all of that to determine, and then we look at, of course, the first thing we look at is what care is needed. So if somebody needs a significant amount of care, and they went from no care to needing a significant amount of care, and they've been kind of living off their Social Security, doing fine. They have a few bucks in the bank. They're doing fine, and they'll be perfectly fine if nothing awful happened, right? Because they could pay their bills every month. And like I said, they have a little extra money in the bank. So if an emergency happens, they have to replace a water heater, they'll be just fine. But when a defining moment happens, a sudden injury or sudden illness pops up where they're no longer able to take care of themselves or need some assistance, and their current resources, income and assets, do not meet the needs of paying that caregiver, either in the home or in a skilled facility, Medicaid is the option for them. So you have to qualify for it. You qualify it for 3 ways. 1, you financially qualify. So you can't have assets those are dollars in your bank account, life insurance, stocks, bonds, annuities, all of those liquid cash kind of things, right? You can't have assets more than $1,600 in the state of Connecticut.
You can't have life insurance. So let's say you have a whole life insurance policy and it has a cash value of $100,000. You have to liquidate that, use it up before you can get on Medicaid.
Yep.
Kind of something like that.
Yeah, exactly. Yeah.
And
For the most part, that is the case. There are some technicalities that you could work around it, but for the most part, that's the case. So you think of all of your assets, not your home, because we'll talk about that in a minute. All of your assets have to be under $1,600. Yes. Yep. And then if you're in the Connecticut Home Care Program for elders, as opposed to being in a nursing home, income is also a qualifier. So if you're over a certain amount of monthly income, you have to apply for yet another program in order to be able to stay at home. And early on I can't tell you how many calls I would get when, Mrs. Smith had her 24/7 caregiver at home, taking care of her and her husband. Everything was going along smoothly. They were getting their benefits paid for by Title 19. Her husband died. She now got his Social Security income, because that's what happens, right? Because it was more than hers. And it pushed her over the limit and terminated her home care, right? So we had to jump through some fiery hoops early on in. Now we try to catch that before, right? And I say we as the community that's helping these people, not just me, but any community member, whether it's the Agency on Aging, Connecticut Community Care, or it's an attorney, or it's myself, right?
Elena, is it an automatic that you get the higher Social Security benefit, or do you have to apply for that?
Deirdre, I don't really know, but it's my guess that it's an automatic. But again, not my zone of brilliance, so I don't want to
you
speak to
could
it.
just turn it down to keep you in the Medicaid.
We don't have to, because there's a way to get around that, right? And if you are not trying to navigate this process without assistance, somebody will have put something in place for you so that doesn't happen. But like I said, early on when I first started this 15 years ago, this would happen, right? It doesn't happen now when anybody's working with me because I don't allow it to happen. We plan for it, right? So I said there were factors. So you qualify from asset, you have to have a need, right? So another, we have to physically, so financially qualify, functionally qualify.
Physically? Is it functionally or physically?
I'm going to call it functionally, because many people with dementia physically are able, but should not be left at home alone, right? So that functionally somebody has to come in, assess you from the state of Connecticut, whichever department that they're going to assign it to, and say, yes, you do have a need in the home and this is what it is. Or a doctor would have to say so if you were in a skilled facility, right? You just can't say, I think I'm going to move into a skilled facility. I don't feel like cooking anymore. And, I don't want to live with my daughter, right? You just can't do that, right? You have to functionally, physically qualify for it.
Okay.
And then the third thing is there has to be a need. So if you can pay these bills, there's no need. If you can't pay them, there is a need. So that's where Medicaid comes in. It is a process. It can be very overwhelming for so many people, and we hold the hands of all of our clients and their loved ones who are trying to navigate this because it is so overwhelming. There's a list a mile long that is required by the state of Connecticut in order to get a case granted.
So you help people get qualified for Medicaid, which I'm assuming they have to do at least 5 years of financials for the look back. They have to do all their doctors and all their medical for the last 5 years to make sure. Is there
doctors and medical for 5 years? No, but they do need financials for 5 years, and you have to review them with a fine-tooth comb, because many times something has happened to somebody and they haven't been taking care of their mother's or father's finances for 5 years. So you have to go through all 5 years, make sure that you have everything that is needed so that application can go in and is granted easily.
How long does that take?
So, we're pretty good at it, so, it depends on, how quickly we can get through it. But the DSS worker, and the DSS departments that you have to, send your applications to, they're regional depending on location, and they're in the greater Hartford area for the Connecticut Home Care Program for Elders. Depends how busy they are.
So you have to go to the Department of Social Services to get it approved.
That's correct. Absolutely. You have to work with that worker.
So then you also help them get placed into like a Medicaid, a facility that takes Medicaid, or assisted living that takes Medicaid, or a nursing home. Do you help them do that?
All of that. Yes, we do that. And that's what sets us apart from most, because I'm a certified elder care coordinator with a legal, insurance, and financial background. So the first thing I got to know was when I was processing Medicaid applications, people would just bring me their oodles of information, and they would just drop it, and they would be, not asking a single question about any of it because they knew that they paid us to do it. But all of their questions were, hey, now what do I do about this? Now what do I do about that? And can you help me with this? And can you help me with that? So that's where the care piece came in. And, you feel for these people because, it's not about just paperwork, right?
Sure.
It's not about, just that one thing. And if you're trying to get care at home, there's a whole other process. There's a whole other piece with a whole different department that you have to navigate through in order to make sure that you're advocating for your client and getting the best quality care in place that is covered by the right programs.
So is there a long list of a waiting list to get into a Medicaid type housing? Because they have to kind of be, is it not limited? Is it, do regular assisted livings that take Medicaid? Tell me how it works. Do you have to private for like 3 to 6 months and then you can get on the Medicaid system? Is there a certain amount of money?
It's all different depending on a client's situation and how, I like to say, how clean an application goes in, right? The thing that I want to impart with you is almost all, but not every, a skilled facility, what you call a nursing home, will take Medicaid. Assisted living, they don't take Medicaid dollars. It's all private pay. And there's a way to be able to support the right client, the right elder that wants to stay in assisted living. There's a way to be able to support them in that, possibly. So I like to get through Medicaid. Yes, through Medicaid.
So assisted living facilities don't typically take Medicaid?
Not in the state of Connecticut at the moment.
But nursing homes take Medicaid?
That's correct.
And nursing homes, will they take Medicaid off the bat before, or do you have to private pay for a while?
It depends on the facility, and it depends on if there's an available bed, and it depends on a number of things. So I literally was just on the phone with about 4 or 5 skilled facilities navigating my one of my clients' needs. And each facility gave me a different answer as to what their new protocol for COVID is, right? So that's a whole other thing. But some will take, if they know me, they know that my applications are clean. They know that I'm a win-win situation. First, the win has to be for the elder. And second, the win has to be for the nursing home. There is no way I want to be able to place anybody in a nursing home and stick the nursing home with any sort of unnecessary non-payment arrangement.
Does that happen?
All the time. Years ago, it used to happen a lot more than it does now. I don't do that. It's not anything I do.
Oh, you mean like they don't have to already have qualified and Medicaid sign on the dotted line before they go into the nursing home?
So what I'm trying to tell you is first of all, if somebody has a need and they have $60,000 sitting in the bank account, they don't qualify. And they have a need for skilled care. They're moving into skilled care. That money will be used if it's a single individual on their care until they qualify.
Got it.
Unless we can preserve it some other way. If there are spouses and they have oodles of cash up to a certain dollar amount, right? Or in certain situations, there are creative ways that we can protect the healthy spouse from being financially devastated as a result of his or her loved one's health issue, right? That requires skilled care.
So you're saying, Elena, that nursing homes often start out with, let's say, that $60,000 example that pays for 3 or 4 months. And then if the person didn't yet qualify for Medicaid prior, now they're stuck with somebody not paying.
So the goal would be, it's not quite. So let me just explain. Hopefully I'm being articulate here. All I'm saying is cash is cash. They're going in. If they have a need for that care, the cash has to be spent or preserved where it would be acceptable through the Department of Social Services. And if you're going into a nursing home or your home, and if you're home and your mother has $10,000, that is not a good thing. If she has $100,000, call immediately. Call me immediately. There's so many reasons why that is important, but it would be my job and for the nursing home's job to make sure that the individual who is running low on cash qualifies for Title 19 so that there isn't a loss of payment there along the way. Okay. And if somebody is at home, those home care benefits do not go retroactive. They are not retroactive at the moment. There has been some suggestion that they should be. I would agree that both that and assisted living should be part of our entitlement program here in Connecticut. They currently are not.
So, Elena, one last question. Is this different state to state?
Yes. Very, very small differences, right? So our cost of living here in Connecticut is very different than Tennessee, correct? So you're going to have different numbers, but generally it's a federal law that's run through each state.
But are there states that take Medicaid for assisted living?
I think
just not us.
Yeah. But I don't think all states are. I really don't. I think we should get creative there. And, again, another conversation.
Oh my gosh, we could talk to you forever.
We can.
But we are going to sign off. We can talk to you forever, but you are a wealth of knowledge. You know so much more. Like, if this is the tip of the iceberg, like Medicaid versus Medicare, there's a lot to know. Yeah. There's really a lot to know. And so people should come to you when? Before anything happens, when they're running low on money, when they have a lot of money and aren't sure what to do. When should they be coming to you? All the above?
I say, yeah, all of the above. So, again, this week we had somebody come in who realized that they were in a situation that they didn't actually understand quite well. And now we're in a crisis situation and navigating it at full speed ahead, right? So if I wanted to take a day off on Friday, I couldn't, because my job is to take care of this current situation. So crisis, we always accept crisis. Proactive planners are my favorite, right? And if you're not in crisis and you kind of can see the forest through the trees, I've got 100,000, I've got 200,000, I've got 50,000. As soon as they hear this, they say, oh my God, let me call right away. More money, more options. Less money, less options, and usually a lot more work. And I say nobody should be doing something like this by themselves, because oftentimes there could be something that we could do to support you that you weren't aware of. And I think that my job is, again, to provide information, education, and options. Their job is to choose.
Excellent. Well said. It's like having a complicated tax situation and trying to do your own home taxes. When you have 22 businesses. No, that's not a good idea. So
agreed.
They should be coming right to you. So Elena, again, like, amazing information. You're so full of information, and I just love your energy, and I love that you really do this from the heart, and the way you just kept incorporating things into your business as needs came up. Makes total sense.
Yeah.
Thank you so much. Medicaid versus Medicare. We are going to say goodbye, and I will talk to you offline.
Okay.
We'll say goodbye, and thank you so much for joining us here on Let's Talk Seniors, and we will see you again, Elena. Bye.
Thank you.
Oh, okay. Thank you so much, Elena. Goodbye. She's a wealth of information. My gosh, she knows so much. There's so much to know. It is really like tax preparation. I hope everybody did theirs yesterday. Elder Life Care, 860-637-0530. 860-637-0530. Elena would love to talk to you. She, as you could see, she's very personal, and she is very easy to talk to, knows her stuff, puts it in layman's terms. I do tend to ask a lot of questions because I like to know stuff, and she will answer them for you. So thank you so much, everybody, for tuning in. I'm so excited that you came, and I will see you next week. Till then. Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.